All right, so hi, Dr. Vizniak with the amazing
Catherine.
with the amazing Catherine. And Catherine's got another wonderful case that I want to go over here with people and share her experience and what she's been through. So why don't you go ahead and start and tell us what this case looked like at the very beginning for you 2 weeks ago?
Yeah, about 2 weeks ago, I started with just a little bit of twinging pain in my hip, and then it pretty much within a day or two went very quickly into my back and my hips, just not wanting to move very much.
Yeah, and so we're not just talking about a little bit of pain here.
No.
Tell everybody what you actually had to do.
I ended up going to the hospital because I was having a really hard time going from a lie down position to a sit up position. Like, I felt like I was stuck. Like, my hips were actually stuck. And I was having so much pain that the hospital was the only option that I could think of at the time that was immediate. My experience there was less than pleasant.
Which happens. You can share as much as you want.
Yeah, so it was basically, I go in there and they tell me, well, you know that you've had back problems, so this will just keep happening and you just need to lose weight and get fit.
Yeah, and so you can imagine somebody with acute pain, and just so we're clear on this was no minor pain. This was like 9 out of 10
Yeah,
pain.
this was definitely a 9.
Yeah, exactly. When she came into the clinic, I couldn't believe it when you walked in, because it was basically, who carried you in? It was...
My son.
Yeah, okay. Yeah, right? Yeah. So they brought her in, and she couldn't even stand up straight. I've got a copy of the pictures of our initial postural assessment that we did. We'll flash those up here really quick so you can see that. Literally, 9 out of 10 pain, could not move, couldn't even rotate around or move around on the table at all. Mm-hmm. Just describe what that was like for you, like even being laying on the table.
It was pretty excruciating.
Yeah.
It was like, I mean, I felt bad because it took so much time to move as well. And I know to get into a sitting position, I had to really slowly move myself onto my side and then push myself up off my shoulder. And as I stood, I could feel my shoulder on this side drooping sideways and my hip, or my side of my stomach, pushing out that way and my hip going the other way. I felt like I was making an S shape.
Yeah, exactly. And it's no exaggeration. It maybe took you 30 seconds to roll over from one side, or maybe even a minute to roll over from one side to the other. This is exquisite pain and tenderness. So you came in for the first visit, and what did we do?
What did we do? We did some stretches, some cat and cow, and a big assessment to make sure that you knew what was going on. Yeah,
absolutely. And by the time that you left, and again, we'll flash the picture up here again, 9 out of 10 pain down to about a 4 out of 10 pain, and you can see how much better she was standing. And then you came back in the next visit, and tell us about that one.
Yeah, I was shocked when I saw the photo of my back to see how much had changed within like 15 minutes, really.
Yeah.
The next time I came in, there was a lot less pain. I was moving quite a bit easier. There was still some jarring movement. Sitting up was still rough, but it was a lot better.
Yeah, for sure. And I had some interns with me at the time, so we could actually see. We did an assessment where we had you touch your toes to see how far you could move.
Yeah.
Again, she first came in, barely could get down and couldn't touch her toes. Actually, coming down, you had to use the table for support.
Yeah, and I needed help standing back up.
Yeah, absolutely, right? And then we went ahead and did our treatment, which involved a lot of distraction, mobilizations as well. And what was it like after that treatment?
Oh, I bent down and I was able to touch the floor.
Yeah, and more importantly, bring herself back up without assistance.
Yes, that was pretty amazing.
It is, right? And these are the kind of results that you can get relatively quickly. So now we are here quite a bit later, and what are the residuals? Like, what do you have going on now?
So all I really have left is on my right side. I have a little bit of kind of a persistent dull pain in my hip, and that's about it.
All right. Yeah. And so our follow-up now, we're working on strengthening here 2 weeks out. What are our focuses for your exercises that you're going to be doing to strengthen your back?
So I'm going to be working on squats and bending and lifting. Yeah. And my major goal, really, that was coming out of all of this is that I have an infant who crawls, and I couldn't pick her up.
Yeah, and this is the big reason I like to share this case with everybody, is the fact that you have people, you think you're worried about range of motion and all this. No, people don't care about that. They care, can I pick up my child? And during the initial injuries, you couldn't actually pick up your child with this.
No, right? I couldn't carry her and walk. I remember when I first decided that I needed to go to the hospital, I was at a friend's house and she had to carry my baby home, and she's literally across the laneway from me. Yeah. And I couldn't carry her home or up the stairs. And then from that point on, the next week, I couldn't bend and lift and pick her up. So I had to have, my husband had to stay home from work and work at home so that he could lift the baby. And just, it was was very disheartening.
Yeah, for
Yeah.
sure. And I mean, the thing is that the thing that's great too, you're even worried about even maybe a reoccurrence of the disc herniation that you'd had before.
Oh, I was
potentially.
really worried about that because that pain, although this pain was very extreme, to have a full herniation was, a 10 out of 10.
Yeah.
And that's what I experienced when she was only 6 weeks old.
Yeah.
And I wouldn't even know what to do if that happened now.
Yeah. And so here we are. It's actually, as far as mechanical low back pain goes, it's a pretty simple case. But the thing that actually set me off a little bit on this was your experience at the hospital at the very start, because it really was not helping you in any way, I feel like. Maybe you did get some pain medication.
Yeah, I mean, nothing that I didn't have at home, really. I have Tylenol at home, but, I did question the doctor, asking what can I do so that this wouldn't happen again, what specifically movements that I could do to help make myself stronger, and he just said, well, stronger core, and I said, what does that mean?
Yeah.
So, yeah.
And as far as the rehab exercises go that we're taking you through here, I'm surprised how good your squat form and deadlift actually was. We switched it up a little bit to do an unequal loading into a lunge, and you could see that was a little bit on the challenging level.
Yeah, that was the struggle, yeah.
Yeah, but that gives us something to work with so we can see good functional capacity out of this for our rehab protocols that will follow for you, Ms. Catherine. So is there anything else you want to add to this at all? Or
It's just that because I'd been here once before, I didn't feel as hopeless as I did the first time that I came, not knowing that I could get out of pain.
Yeah.
This time I was really confident that I could.
Nice.
And that was good feeling.
Absolutely, and that's really half the battle. If your patients, Catherine, can feel the confidence and the belief in future wellness, you can get there that much faster. When you come in with 9 out of 10 pain, and 2 weeks later you have next to nothing or nothing, like those are the kind of outcomes you want. Or in fact, even better yet, after 15 minutes, the pain is cut in half, and the next visit the pain is cut in half again. Those are the kind of results that really matter for people, and being able to pick up your baby again, that's the biggest thing that makes the biggest difference for me on this case. So I just want to thank you very much for sharing.
Yeah, no problem.
All right, thank you.